Hi there, my name is Dr. Sheridan. I am a professor of human sexuality in the Rehabilitation and Mental Health Counseling program here at USF. I'm also a licensed mental health counselor, a board-certified clinical sexologist, and a certified rehabilitation counselor. So what do I want to talk about? I want to talk about sex. Who doesn't want to talk about sex? A lot of people don't want to talk about sex. It's used in our culture to sell everything. Mostly everyone is doing it, but no one is talking about it. We're told from a very early age that it's bad or dirty or wrong, and when we get those negative messages about our bodies, or no messages at all, if it's avoided or if it's seen as something taboo or wrong, we don't get the information that we need to protect ourselves. So the key issue in my talk is going to be the fact that good, collaborative, comprehensive sexuality education really is sexual violence prevention. This is so timely. This is a barrier we need to break. Look at the Me Too movement. Look at Time's Up. Look at the USA gymnastics scandal. There are so many things that are going on right now where people are believing survivors. We're listening, we're understanding, and we're more apt and able, we may be turning that corner to talk about sexual issues. And until we have the ability to talk about sexual issues, whether it's our own bodies, our body functions, pleasure, the good stuff, the positive stuff, or some of the negative stuff, sexual coercion, sexual victimization, childhood sexual abuse, the violence against men and women and children. If we can't talk about the good stuff or about our body mechanics, however can we impact these cultural epidemics that are going on right now? So I want to talk about how we don't talk about sex and how we need to, and that if we use humor and if we have a great knowledge base and a working, comfortable, confident vocabulary about sexual matters, we are much more likely to impact some of these issues. So what I think is important to understand is that we tell our children very early on, we give them lots of rules about lots of different things. And we tell them, you wear a bike helmet, you don't smoke cigarettes, you don't get into a car if someone is drinking, stay away from drugs, stay away from alcohol, wear your seatbelt. There are so many different things that we say very clearly, and we say them over and over. We say them throughout the lifespan. It's not a one-time talk. It is a series of ongoing conversations throughout the ages and stages of development. And we don't do this about sex. So when there's an opportunity where you have to go through the mental Rolodex of what should I do in this situation, or how do I protect myself, or can I say no, or should I ask, we don't have the answers. So that's what I want to talk about. And I think it is time. And I've been standing on this lonely island for so long, and I'm ready for everybody else to jump on board and to break some barriers.